राजीव जी, आप प्रेजेंट कर सकते हो ना स्क्रीन?
Yes, sir. Yes, sir.
हाँ, कर लो कर लो।
Yeah. So, good afternoon, everyone. A warm welcome to each one of you joining us today for this crucial online consultation on attempting to eliminate illegally available nicotine product in India. So, this event is jointly organized by Sipher Chandigarh, Faith Foundation Gujarat, in collaboration with the Resource Center for Tobacco Control (PTI) Chandigarh and GSA Mohali, Generation Savior Association Mohali. We're technically supported by Eco India platform. Thank you. And we are honored to have the participation of distinguished leaders, policymaker, policy, public health professionals, and advocate, all united by the common goal to address the present challenges posed by illegal nicotine product in India. As we know, these products not only pose significant health risk, but also undermine the effort of tobacco control initiative across the country. So together, tough collective discussion and strategic collaboration, we aim to address the challenge and understand the implementation and identify the actionable solution to curb this growing issue. So with this, uh, let's start with the inaugural of this session. And I will honored to have invite Dr. Rana J. Singh, sir. Dr. Rana J. Singh, sir, is a director at Tobacco Control Southeast Asia Vital Strategy, which has played a significant role in influencing tobacco control law and policy in India. Sir, pulmonologist Dr. Rana, sir, has consistently supported the center and the state government in advancing the tobacco control agenda with the technical assistant, capacity building, research grant, implementation strategy, along with his team. And over the last decade, he has conducted extensive research on the efficacy and integration series support with the patient and TB treatment rhythm. And
चलिए
sir
राजीव जी
has, yeah,
So Rajiv,
thank
we
you,
can,
sir. And
we can skip the
yes.
details, sir.
Thank you
thank you,
very
sir.
much.
Over to you, sir. Can you just give an overview of this issue with the participants?
Okay. So thank you, Rajeev. Good afternoon
अगर
to.
ये इसका लेना हो ना स्नैपशॉट,
So please. So good afternoon, all of you. So Rajeev, I am audible.
Yes, sir. You are audible.
Yes, thank you. So respected Dr. Rakesh Gupta, Director Public Health Sipher, our dear Dr. Avinash Sunthlia from Ministry of Health and Family Welfare, team of PGI MER Chandigarh, Resource Center for Tobacco Control, Rajeev and colleagues, all the collaborators for this webinar, Eco Platform, Faith Foundation, Generation Savior Association, and good presence of Team Gujarat, from where we are. I hope we are going to learn many things later to implementation and enforcement of tobacco prohibition of electronic cigarette act. We have Mr. Stinder and Dr. Jayesh and Dr. Rakesh Gupta ji, all the participants, all the speakers, panelists in this session. So first of all, thanks for organizing this much needed webinar on illegally available nicotine products in our country and how we can eliminate their availability and their use. Definitely, just as an overview, if you ask me, I still remember, I think it was year 2007 when all global efforts were being made for tobacco control, including in our country. You all know that India developed its national tobacco control program in 2006 and 7. A draft program was made, and so these were very initial days. And when we started about this product, I also started learning much more about the product. what it is made of, its constituents, what are the various types of products which are available, how people are using them, how many are using them. So these were all very important questions at that time. So if we really look at the journey and history of these products or and e-cigarette and related products and other nicotine products, it is really one of the fastest. It is one of the fastest journeys for any product, which has become so popular in such a short time, as well as it has captured a huge market for itself. Many of you are aware that it is not very long ago. It was in year 2003 when the product was invented in China. Um, and almost at the same time, that was the time when globally WHO FCTC was being discussed and negotiated. So you see, it was in 2003. No, in such a short time from first generation e-cigarette, which were like cigarettes, like then tank type, then pen drives and pods. So up to fifth generation. So such a fast development of this product. It's really something very astonishing. Uh, then how it started its commercial journey. It was not in the initial period. It was not the tobacco industry which was promoting it. It was by companies who are making it commercially available. But later on, now keeping in view its huge potential. So now tobacco industry is now has also been involved in this whole product. At that time, there was no regulations, and we were all wondering what we should do. At that time, countries started making various efforts. Some started talking about its regulation, just like we have other tobacco products. It should not be sold to anyone under 18 years. It should not be advertised. So so situation was really very complex. Not much was known about the product. What are its constituents? And in very short time, it had a large number of flavors which were available. And after many studies, now people started knowing its chemical constituents. What are the various harmful chemicals which are available? Whether they are formaldehydes, hydrocarbons, benzene, and then heavy metals like lead, cadmium, nickel. So all those constituents which are present and which pose a, a, a health risk to mankind. Earlier, after now, it was nothing was known about the harms of tobacco, about e-cigarette. But now, after many studies, we are aware that it almost, again, just like tobacco, we say it affects almost every organ of our body. Same situation is coming as far as e-cigarettes are concerned or nicotine products are concerned. So we have now many varieties of lung diseases which can be caused by e-cigarettes, cardiovascular diseases, then nicotine poisoning, which can lead to nausea, vomiting, diarrhea. It can lead to seizures, collapse of the lung, then EVALI, which we call vaping associated lung injury, honeycombing of lung, prenatal harms. So almost now, I think now we are aware of all the harms e-cigarette or ends can cause. So it is not only harmful effects, but what was the other big risk? It denormalizes tobacco use. When we were doing our efforts for tobacco control using WHO, FCTC, and Empower. So this product was something which was a challenge to our tobacco control efforts. So this is about the beginning. varieties of tobacco products now, nicotine products are available. Not only now original e-cigarette, but now many products have come up. Even products like heated tobacco products, then nicotine gummies. We have nicotine pouches like Velo and Zin. We have toy pods which are now available. Nicotine strips are available. So now it is really the range of nicotine products which is available that has really changed. No, what should they be called? So tobacco industry always prefers to call them as new generation products, which is perhaps something very wrong. These are new emerging nicotine products, which we must be aware and take appropriate action. So really they have proliferated. They are available now at point of sale, varieties of point of sale. It is not only the shops which are selling tobacco, any departmental store, gift shops, men's stores. So these are available almost now at many such places and including online sales. And these products now have become a gateway of tobacco use. People although start on nicotine products, but later on they have started using tobacco products. So current situation is really alarming at this time. Global market for electronic cigarette is really now growing in such a short time from 2000, you can say 2018 to now in this in 5 years to 2022, the market has grown from $7,000 to almost $23 million in such a short time. There is no, I think, no other product which has grown so rapidly. Large number of products are available. Large number of flavors are available, and which are posing a huge challenge to our tobacco control efforts. So now the question is, what should we do at this stage? Globally, as you are aware, many countries now they have come up with various kinds of policies, from simple regulations, so to ban with complete prohibition of these products. There are efforts to use the product as a tobacco cessation drug also. So in fact, these are the efforts which are being made globally. In our country, I still the issue was highlighted way back in 2008-9. So Ministry of Health and Family Welfare, they invited a few meetings in year 2000, I think 11. First there was some discussions, then finally in 2012, first meeting, and then 2013 and 14. A few big consultations were organized by ministry in collaboration with various experts. And finally, we had an expert group in the country. There were 3 subgroups were constituted. One subgroup was to look at harms of e-cigarettes. Second group was constituted what kind of awareness generation activities should be IC and should be done to inform people about harms of these products. And third group was policy group. So these were 3 subgroups were constituted by Government of India. And after many years of work by these subgroups, and then one white paper by ICMR, Indian Council of Medical Research, that laid the foundation for prohibiting e-cigarette in our country. So finally, we have our law, which is called Prohibition of Electronic Cigarette Act 2019. So that was about an overview, global efforts, and now in our country. So now what is a challenge? We have a law. We have a law. It's overall, it's quite comprehensive. It covers almost every aspect of e-cigarette, from its from its sale to manufacture to transport to storage, quite comprehensive to import. So I think it covers almost every aspect. But still, there are no challenges. First challenge is definitely enforcement. So enforcement has remained a little bit because that is something which states.
Yeah, Dr.
States
Avinash,
are-
Dr. Rana, this will be covered by other people.
Yes.
So,
So there are some challenges. So definitely that is enforcement, huge marketing. So digital and social media, aggressive and misleading marketings. So these are a few challenges of e-cigarette and actions. So I always say there is a law, it has to be implemented. Simple with IC, with simple with awareness generation, things will not change. There is a law, so simple mantra is enforcement, enforcement, enforcement. Then reporting of violations to authorities, very important. We need to see. And who needs to take action? It is the states. It is the states which need to take actions. So that should be very clear. Gujarat is a good example for us where many multiple agencies, whether it was Directorate of Revenue Enforcement, whether it is Gujarat Police, whether it is Cybercrime Police. So they collectively they are doing some good work and there has been big seizures of various products, e-cigarette products from Gandhinagar, Rajkot, Surat, Ahmedabad. So overall, this is there is good I think plan which is there in state of Gujarat, and I think we should replicate those models. Then we also need to have a good monitoring system, how we can monitor the point of sale, online retail shops. So this is something which we need to keep in mind. And states, it is only the states which need to take action. And there are some components where other ministries can also play some important role. So with this, thank you very much. And let's see what are our recommendations after this workshop, after this webinar, which we can, I think Dr. Rakesh Gupta must have planned to provide all those recommendations to the concerned authorities so that we can tackle this big challenge. Thank you very much.
So thank you, Dr. Rana J. Singh, sir, for your kind words. And you highlighted so many things during your address. So we'll try to address, and this discussion is particularly planned to address these particular issues. Thank you, sir. So let's move to our next guest of honor, Dr. Avinash Sunthlia. Dr. Avinash sir is at DADG, at Directorate Ministry of Health and Family Welfare, Government of India. So Dr. Avinash sir is a public health professional with more than 11-year experience working as various level in the health system in India at district level, state level, as well as national level. So over the year, he has been involved in micro planning, implementation, evaluation, monitoring, and operational research activity at the various national health programs. So, the core area of interest is evolving public health economics for affordable, equitable, and accessible healthcare to achieve universal health coverage, thus serving as a poorest of the poorest. So, over to you, sir, for your address.
Thank you, Mr. Rajeev. Shall I share my screen?
Yes, sir.
Okay, thank you. I'll just have a short presentation.
Yes, sir. We have given access. Please go ahead.
Rajiv, after this, you may take a snapshot also after Dr. Avinash.
Sure, sir. Sure, sir.
My screen is visible. Is it visible?
Not yet, sir.
Okay.
Dr. Avinash, you need not just present your PPT. You can just read it out. Yeah, it is now
It's
visible. Yeah, you started sharing the screen. Still, it is not visible.
Now
No, it is not visible.
so it's showing that screen share is
visible.
started.
Now it is visible.
No.
Now it's visible.
You can just stop it and start sharing again.
Can you try again, sir?
Just a minute.
Or you
I
can
think
just
now
read it out.
now
Really
it is
doesn't
visible.
matter.
I think now it is visible.
No,
Is it?
no.
So it's showing that screen share has started, but PPT is not visible.
Dr. Nash, it will be okay if you just read it out. Doesn't matter.
I'll just search a minute. I will make one participant can. I will just make one last attempt.
Okay.
Okay.
Yes.
Yeah, now it is visible, I think.
Now it is visible, sir.
Yes,
Can
sir.
you
Now
just
it's
click the Pika?
Your
Just click at the
screen,
Pika.
your screen is visible now. Click on.
The slide on the slideshow mode, sir.
No. It's not visible.
yeah,
now?
sir, can you just
Now
start
it is-
again and select the PPT directly instead of selecting the box? Can you stop the screen and start again and just select the PPT slide only directly?
Actually, PPT slide I am trying to share.
Yes.
The PPT is already opened in the background.
Yeah, so you select
उसको
the
select
PPT.
करके sir, please that
Okay. Now the PPT open. Now I could just do the sharing again window. Now this is open. Now I am sharing. Now it is visible, sir. Now
Yeah, sir.
No,
So now
it's gone again.
So it's visible now. Can you just do it again?
Earlier it was visible.
sir, is it?
So now screen is not here.
Hello.
Yes, sir. Sir, your desktop is like we are able to see your files, but not directly the PPT.
Now can you see, sir?
Yes, sir. So just make it full screen. Yeah. Now your slide is here.
Do you want me to put it on full screen?
Yes, it's better if you make
Screen
it a
पे कर
full
दीजिए
screen.
आप ना.
Otherwise, you'll go ahead. No issue, sir.
So I will put it on slideshow mode.
Yeah, please. Yeah. Thank you.
Now is it okay?
आप ऐसे ही कर दो, कोई बात नहीं. अच्छा, and we just need the initiatives of
Yes, sir.
MACT. Yeah.
Is it okay now?
हाँ ठीक है आप कर दो चाहे कोई बात.
Yes,
I
sir.
have
Yes,
put it on slideshow. You can see it. Now quickly I will just brief. So welcome to all the esteemed experts in tobacco control who are here, and certainly this deliberation is very useful in augmenting our effort for tobacco control, preparation of future, and of course how to make course corrections in our journey towards tobacco cessation and of course tobacco control. Now, as the e-cigarettes is certainly a new product in the market, and since 2003, after it was launched by China, a lot of improvisation in the devices have been, and one of the biggest challenge which we are facing currently is that it affects our tobacco control strategies also, that is denormalizes the tobacco control efforts, which has been done sincerely by all the agencies, right from the WHO, RCTC, and all at the global level and at the national level by respective member states as well. So this is something which we need to all keep in our mind while making an action plan or a strategy for tobacco control. Another is that it is a gateway for tobacco use, because this is e-cigarettes is something which is very attractive as well as at the same time addictive, because it has mainly the nicotine content of tobacco in it. So this is very attractive for the younger generations. So the younger generation in future who are using e-cigarettes are potential and consume something which is a cause of concern, and there are people who also advocate it as a tobacco cessation product, which is certainly not correct. So with this background, I shall quickly come on to the various steps which had been taken over the years by the government, and what all necessary requirements are there to keep up the pace of tobacco control in the future. This is the morbidity, and this highlights the extent of tobacco use in the country. What is ENDS? If I ENDS is electronic nicotine delivery system, which are battery operated and commonly used as vapes as well. And one of the key features is that flavoring substances are there, which makes it attractive for the younger generation. Nicotine is one of the most addictive substances, and as we talk about tobacco control efforts, nicotine is a component of tobacco control, and future of in future we will have to talk about nicotine. And
Dr. Avinash, I think there's a problem. You have muted yourself. You muted yourself.
So
You can just read out the presentation. We are not able to see, but you can read out.
Do I need to start all over again?
No, it's all right. It's all right.
So since e-cigarettes is electronic nicotine delivery systems are battery operated, and nicotine need to address on priority, and it is one of the challenges for tobacco control. Certainly it is a gateway for the younger generation for tobacco use, and the adolescents who are using who could be using tobacco in future initially may start off with electronic cigarettes. Now tobacco companies are interested in ENDS, and initially of course it was not being developed by them, and after 2012 being developed by tobacco countries. They are the generation of the efforts, and it is a challenge for the scientists, public persons, politicians, as well as policymakers to continuously rephrase the policies and look for newer initiatives. Now, what is the harmful effects? The evidence for harmful effects. First is it is one of the strong carcinogen, that is a tumor factor. It is cardiotoxic. It has harmful effects on the respiratory system as well, causing drugs. Research has shown that e-cigarette users have 6.17 times the odds of initiating cigarettes as against never e-cigarette users. And continuing with the then we have the impact on the adolescent brain. Attention and learning is impaired, and there is risk, as already told, risk of becoming lifelong nicotine addicts. Pregnancy outcomes, there are oral effects leading to dry mouth and oral mucus, submucous fibrosis. So all of this, these are the harmful effects of ICM white paper on ends in May 2019, which was also one of the basis for the PECA 2019, and it recommends complete prohibition of ends on e-cigarettes. These are some news items globally wherein vaping has killed young adolescents. The product characteristics which are dear to electronic cigarettes is attractiveness, addictiveness, and of course toxicity is there. Attractiveness and addictive, they are utilized to make them more appealing to the new users, and reducing masking or flavoring, and they of course also reduce the perceptions of safety. Nearly 20,000 e-liquids and 250 unique flavor descriptions. This is based on an overview of a Dutch market. We can see all sorts of flavors, and all these flavors are something which is common. Fruits, they akin to fruits, such as the desserts or fruits or berries or candy. So these are done so that the products are shown to be projected to be harmless. As there has been a global ban and regulation of ends, India also has a electronic cigarette PECA Act 2019. 34 countries ban the sale of ends. 87 countries regulate ends. So yes, regulations are in place, but then as discussed, which needs to be done strictly, so things can be under control. Some of the efforts by tobacco, the ministry, right from CODPA 2003 to WHO FCTC till PECA 2019. So this is the journey of tobacco control over the years. And if we specifically see the journey of ends ban in India, which started off in 2012 with the
Dr. Avinash, will like to hear about the portal.
The
grievance
Haryana
portal
High
you have
Court
launched.
directing the team specifically. Yes.
Yeah.
And then we have this Punjab government initially starting with the banning of ends, and then we have the advisory from MHFW in 2018 to ensure that any ends product, including e-cigarettes or like devices, they are under the Drugs and Cosmetics Act. Then we have the CDSEO informed states and UTs drug controller to take action under the MHFW advisory. In continuation to that, even the Central Board for Indirect Taxes and Customs issued enabling circulars for ban on e-cigarettes. So with this, the PECA Act 2019, it was gazette notified 19, and this is the process of enactment over this years. This is something summarizing after when the act was gazette notified, DO letters were sent to the states and DGPs and stakeholders communicated regarding the pan-India ban on e-cigarettes. We have a portal to report violations of PECA 2019, and POTCA of course as well. And monthly we are doing the meetings to review the complaints which we are getting. Yes, but in spite of all the efforts, electronic cigarettes in the market, and this is something which is a cause of concern. The enforcement needs to be strengthened, and we need to also find out methods of strengthening the enforcement measures, because the industry, through their innovative tactics, they are trying to target the younger generation. So these are some of the challenges which we are facing with respect. Broadly, we can divide it into three parts: the industry challenges, the regulatory challenges, and of course the marketing and promotion. So implementation of existing policies. One of the biggest challenge, of course, is also the lack of awareness even among the health professionals. Last week I was going through an article by one of the respiratory chest expert, wherein trying to promote the e-cigarette as a solution, as a harm reduction measure to tobacco cessation. So this is something even the health professionals need to be advocated, that yes, we need to this is something which is illegal and should not be advocated and popularized. The marketing and promotion, of course, that is one of the biggest challenge. So tobacco attempts. These are also attempts by tobacco industry, social media and newspaper articles, which I have mentioned, and papers published, which are certain scientific studies they are trying to publish, which support ends as a harm reduction device. So the way forward, yes, this is something which as a team approach we can do through the involvement of the civil society organizations, the government, the state, internationals, local level. The community support also should be there. Even the parents of the children also, they should be aware, and they should also ensure even the schools and colleges. So sufficient enforcement and awareness should be there at every level. Op-eds or articles by key eminent persons in support of ends ban is something which can be done. Monitoring evaluation, that is very important, that how many violations are there, and then how what is the level of enforcement which is being done. Capacity building.
Dr. Avinash, we want to be specifically know about the grievance portal. Can you just focus on that, please?
Yeah, grievance portal. Grievance portal address wherever suppose they find out certain any availability of e-cigarettes they are getting on the online or in the print media or any sort of advertising they find. So that can be put on the grievance portal, and monthly we are taking a review of that, and then it is addressed at an appropriate level. Yes.
So thanks a lot, Dr. Avinash. You have been very elaborate on your initiatives. So over to Madam Susan for a formal vote of thanks. Yeah. Thank you, Dr. Avinash.
I am very appreciative, and I am thankful to Dr. Rana, Jayesh, Director, Southeast Asia Vital Strategies, and Dr. Avinash, DADG from Ministry of Health and Family Welfare, for giving us an overview and an insight into how big the issue of illegal nicotine products is, and how PECA has been very instrumental in the current scenario to address these various kinds of nicotine products that are coming down into the market. With that also, I would like to acknowledge and appreciate and welcome the participants for today, Mr. Cyril, Dr. Professor Narendra, Dr. Gurman, and especially Dr. Jayesh, Katira, and Dr. Vijay Patel from Gujarat, because this comes out also as a result of the 12 webinar series which was taken up in Gujarat, wherein we discussed PECA initiatives in Gujarat, how they were taken up, and especially under the guidance of Dr. Katira, this was possible, and hence I would like to welcome him as well, and especially being the Diwali time also, he spared his valuable time. I'd also like to acknowledge Mr. Sitendra Kumar from the regional Directorate of DRI Surat for sparing out his valuable time to discuss with us this time. We will now move on to discussing, having the presentations of the speaker today and then the panel discussion from all of our partners, especially even from Mr. Prabhakara. We have Mr. Ranjit Singh, Dr. Shivam Kapoor, Dr. Asta Baga, Mr. Binoy Matthew as well. And I especially want to thank Sipher and RCTC and the Generation Saviors Association, Madam Upender, for sitting down with us on this important consultation, which is to be an important way forward in dealing with tobacco products in India. So once again, thank you so much and welcome to the consultation today. I look forward to jotting down very important points and coming up with good tangible points to be taken in order to address the issue of illegal nicotine products in India.
Yeah, Susan,
Over to
please note down the
Thank you so
important
much.
points for the recommendations so
Hanji,
that we can frame the draft the recommendations. Please do it. Thanks.
please.
And
Thanks.
Madam Upinder will be moderating with you. So you can just introduce the experts alternatively. Right? So before that, I think we can have snapshots. Rajeev, can you take snapshots? Kindly open up your videos.
Yes,
So
sir.
Dr. Rakesh Gupta from RCF is also with us. So welcome, sir.
Yeah,
Can you
so
please
we
open up the
request
videos?
we request everyone, please switch on your videos for some time.
So thanks all. Yeah. So Rajeev ji, you have taken the snapshots.
Yes, sir, just a minute, sir. Second screen I need to take. Yeah. Yeah, done, sir.
Okay, thank you.
Over to you, Rajeev.
Yeah, thank you, Susan ma'am, for proposing vote of thanks. Now we'll start a technical session. We will start with the good replicable practices of states. So to moderate these sessions, I'm expecting Upendra madam, Upender Gill and Sujan ma'am to moderate this particular session.
I am to believe that we have the presentations one by one, so we can start
Okay.
with Mr. Cyril Alexander from MACT.
So I can
Chennai.
tell you the background of the issue if you permit me to do that before
Yes,
the good
sir.
replicable practices.
Please.
So it's a very short presentation.
Okay,
So
sir.
please allow me to share the presentation.
Okay, sir.
Okay. So I'll be
Yes.
talking about the this is the background of why this webinar was held, attempting to eliminate the legally available nicotine products. So we can't ban the legally present products, which are the NRTs basically, and any NTPs, the new emerging nicotine tobacco products, they need a mention in this webinar. To aggravate the situation of the tobacco epidemic, the tobacco industry is aggressively introducing novel and emerging nicotine and nicotine products, such as electronic nicotine delivery system and non-nicotine delivery system also, heated tobacco products, nicotine gummies, nicotine dissolvable products, snus, and nicotine pouches. This is just to lure the youth into use of such products. Notably, these products are often flavored to make them more attractive to youth, as told by Dr. Rana. So some of these products, they are also available in India. And nicotine gummies and nicotine pouches, they are the most popular products available for the youth. So these are the products: e-cigarette, nicotine pouches, heated tobacco products, nicotine gummies, toy pods, snus, nicotine hand gels. So these are variety of products available. So e-cigarette use, they began as a healthy alternative to cigarettes, but it is now a global health epidemic with young people, as told by Dr. Avinash and Dr. Rana as well. So some of the products, they are available in India also. So I'll just let you know what are the products available. These are disposable electronic cigarette starter kits are available. Nicotine salts are available, and these are all the products which are available in India. Even the nicotine pouches by the name of Zin, Velo, Zin. So different kinds of flavors are available in India. And even these products are available which show video games on it. And some of these games, they reward users for each puff of the nicotine. And the social media is pushing vapes on young Indians. So this is September 2024 study by PHFI, that is Public Health Foundation of India. Then highlights of the study in 2022 are: despite comprehensive bans, electronic cigarettes are available to the young people, higher levels of education, more use of the electronic cigarettes, low prevalence of daily use, and tobacco use was strongly associated with, that is, the dual users is there. And so greater monitoring and enforcement efforts are required. So these are, this is the background I wanted to share. So over to Ms. Susan and Ms. Upinder for moderation of the session regarding the good practices. So thank you. Thank you.
So thank you so much, Dr. Rakesh, for that introduction. So now moving forward to learn from the states that have done some really good work. Request Mr. Cyril Alexander from MACT Chennai to talk about what has been done in Tamil Nadu, and also with his expertise, if he can throw some light on the OTT violations that we talk about and the violations that are happening in movies regarding the vapes. So over to you, Cyril.
Thank you. I think my slide is visible.
Yes, it is.
Yeah, thank you. Nowadays we are talking about tobacco control. For tobacco control for a cigarette and other products, it's tobacco control. But fortunately, we are able to ban the electronic cigarette. So that's the very success. Very much. That's very important for me, because when we are working with the children, we know how much the issue is, how big it is. So so finally we banned the product, and then but still the product is available. See, the electronic cigarette has been banned in India, but still it's available. The only thing is the manufacturing unit is not available in India, but still the smuggling is happening. These are the two things: the smuggling and then the sales of the, what are the strategies they are using for advertising and all these kind of things. So the smuggling has to be handled, and then the sales, how they are promoting, how the product is reaching to the children is very much important. So for that, in our state experience, since Tamil Nadu also banned before the national ban, we banned in Tamil Nadu, but still the product was available. So it's available in the online. And then when we order through online, we are able to get the product in our office itself, in our even our organization name itself. No, you can get the product in our organization also. So after that, the online portal has been addressed, and then most of the onlines have been banned, and all the cybercrime department also, they worked and then they banned. But still, after some time, they flourish like anything, and then again the lot of products are available in the online. Now they changed the strategy actually. So before that, you can order it through online, but after that, what they are doing it now, you can send a request through online. Still the products are available online. You can send a request or you can just register yourself. After that, they'll be contacting you directly through other social media like WhatsApp. They'll be coming to you through WhatsApp, and then through WhatsApp they'll be negotiating with you, and then they will provide all the product details and everything, and then you can purchase the product. So they change the strategy, and then they are also using the Instagram, the next level, and then the social media. So we got this information, and then we send a request to them. So through WhatsApp, and then through WhatsApp, they are able to give demonstrations, and then what are the products, and then everything has been happened through WhatsApp. And then before that, they used to send it through courier or postal. But now they are sending it through person. You can get it like a home delivery, like Swiggy or Zomato, like that. So directly they will come and they will hand over it to you. So we got the product in our office itself. They came to our office, and then they gave this electronic cigarette to us. And then we documented everything, and then we approached the health department. And then that time health department, they are not able to do it because of the current deputy CM area. That's a constituency of deputy CM constituency. So they are not able to do it. So then we approached the police department. At that time, Asra Kak was the commissioner, the North commissioner. So we approached him, and then he is a very active person. And then we immediately form a committee. We immediately form a team, and then he did some investigation and all these kind of things. And then he is able to hand the product. He is able to seize the product, and then he is able to arrest the persons also. This is the first time in Tamil Nadu. In other places, in Chandigarh and other places, there are many enforcement are happening, but this is the first enforcement drive in Tamil Nadu. And then thanks to Dr. Rakesh and our friend Mr. Ranjit supporting this actually. So they gave some information and how to do all these kind of things. Based on that, we are able to take action in Tamil Nadu. But still, the issue is all over India, the product is available. It's a smuggling product. It's not. There is no manufacturing in India. Why we are not able to stop the smuggling? And then other part is since it's available through the online, and they are using the social media, why we are not able to address this issue? Even we through our portal also, the central government portal also, we did many complaints, but we are not able to get the response. So I think the enforcement, really, we have to be concentrate on the enforcement in national level instead of going to the state, and once we are allowing the product inside the country and then taking action. Maybe we have to be very vigilant in the border areas, and then not allow the product to come inside our country. Then it will be good, I think. So that's the experience. And then now, based on this enforcement, we are able to move to the next level, and then keep on doing they added in the regular visit and other things also. So now it's okay, but still we are facing the issue. That's experience. That's the experience from Tamil Nadu. It's a small one, but this is the first one actually. So we will see. Thank you very much.
Thank you so much, Cyril, for your presentation. We've always looked up to Tamil Nadu and Cyril's work in enforcement and countering the industry with the new tactics. I would now like to invite Professor Narender Ahooja ji, who has retired as the state drug controller for the state of Haryana and is now currently with the MVN University, Palwal, Haryana. So he has done some commendable work in regulating the e-cigarettes even before the PECA came in place. And Haryana, he's shown Haryana the way to kind of effectively enforce PECA also. So over to you, sir. We really look forward to your insights on the topic.
Thank you very much. Actually, e-cigarette, only PECA is not effective in controlling the e-cigarette. I'm making a sweeping statement in this regard because before PECA came into existence in 2019, we were working against such products which are containing nicotines or tobacco, and we have done a commendable job. Haryana has done a commendable job by invoking the provisions of Drugs and Cosmetics Act number 1. Nicotine is well covered as an approved drug by the DCGI under Drugs and Cosmetics Act, and many of the industry has got the permissions to manufacture nicotine as an API or the bulk drug or a raw material, and which is generally used for the manufacturing of nicotine gums, which is again approved, and not only approved but exempted from any sale license under Schedule K of the Drugs and Cosmetics Act with Rule 123. This is the basic problem. When nicotine is covered under Drugs and Cosmetics Act, therefore I am of the considered view that action is required to be taken along with the PECA and other acts under the Drugs and Cosmetics Act also, because this is an unapproved dosage form of a drug. We can say like this also, and many of the cases are still under trial, and in many of the cases in Haryana, the accused persons have got the punishments. One, under PECA, the punishment teeth is not that much deterrent effect, because under Drugs and Cosmetics Act, it is more than 5 years when a person is manufacturing any nicotine products, which we may classify them as a drug, which is not less than 5 years. Then not less than 5 years punishment is much more, and people really have some fear about that. Second is, we have also covered this nicotine under Poison Act 1919 with Haryana amendment at serial number 20 of the poison list of poisons. At serial number 20, we included the nicotine as one of the poisons. Therefore, action can be taken in the Poison Act 1919 also. And I want to give one example here. Cipla has filed one PIL and in the High Court of Punjab and Haryana, saying that this inclusion of nicotine in the Poison Act, poison list of poisons is wrong. But High Court of Punjab and Haryana has given no relief to the Cipla, and therefore for selling even the nicotine gums in Haryana, they require a license and approval from the civil surgeons, who are the competent licensing authority under Poison Act 1919. Therefore, misuse can be stopped. And another one more thing I want to share with you people, because in Haryana we have invoked the Juvenile Justice Act, which clearly says that giving poison to the children below the age of 18 years is a punishable offense, and in which a punishment of 7 years can be given, which has a very deterrent effect on these products. And when we invoke all these together, then only PECA don't have that much of deterrent effect, because the punishment prescribed under PECA is very less. But under Drug Act, it is 5 years. Under Juvenile Justice Act, it is 7 years. And under Poison Act, it is again a good amount of punishment is prescribed. Therefore, I suggest, as the Haryana has done it many times, that we must invoke all the relevant acts while taking action against not only the e-cigarette but all other products which are containing nicotines as one of the ingredient. Here, what are the other products? I want to tell in few lines only. Number one, chewable tobacco. All the scented tobacco products are containing nicotines. These are covered under the definition of food. Even if it is containing 99% of tobacco, only 1% of scent or eatable material, then also it is covered under the definition of food. And any food article under regulation 2.3.4 of Food Standard and Safety Act, any food containing nicotine or tobacco is prohibited, being injurious to the health. It is clearly prescribed in regulation 2.3.4, and every state through their commissioners have issued the notifications banning such products which are containing nicotine or tobacco. Therefore, if any state has not done that, issued that notification, from us, from the state of Haryana or the other states who have issued these notifications, issue those notifications and start taking actions under the Food Safety Act also. Second is these nicotine containing creams are available, which are generally used as a toothpaste, which is also banned under Drugs and Cosmetics Act. No toothpaste should contain toothpaste or tooth powder, both should contain tobacco or nicotine, being injurious to the health. This was notified way back in 70s in the under the Drugs and Cosmetics Act. Therefore, these products can be banned very easily, invoking and using those notifications under Drugs and Cosmetics Act. One Gulab eastern states are suffering from this. Bihar, Odisha, Jharkhand, and many other states are suffering from this. They have one product called Gulab Marka Gul. Gul, the people they are using for cleaning their teeth in the morning, and this contains a huge amount of tobacco and nicotine, and this is very injurious for the health, and this is the cause of oral cancer in the persons who are using this. Since this is banned under Drugs and Cosmetics Act, you can very easily take action under Drugs and Cosmetics Act for manufacturing and sale of prohibited cosmetic items or prohibited products. These are the few other things. And one more thing which is coming.
Thank you,
Professor just 1 minute.
In the interest of
Dr.
time,
Rakesh,
in the interest of time, we'll ask you to let us know about how you have notified
just
drug
last
inspectors.
line, just one last line I'm telling you, that is tobacco molasses. This is a big problem in the hookah bars, and Haryana recently, just 3 months back, has come up with a new amendment in the Kotpa banning the hookah bars and flavored tobacco molasses. That's it. Thank you.
Another thing I'd like to add is that Mr. Ahooja, he notified all the drug inspectors under PICA. So that is another achievement of Rana. So over to Madam Upinder, please.
Okay. Thank you so much, sir. There's always so much to learn from you.
Thank you.
Enforce and use the laws so effectively. And apart from the Food Safety Department, Haryana has also notified the Health Department under PECA to take action against e-cigarettes. So now moving on, I think the stage is set, and we have Dr. Gurman, who would be talking about the state experiences from Punjab. Punjab being the first state to ban e-cigarettes much before the national ban came in action. So over to you, Dr. Gurban, to share the Punjab experience.
Pinda, I think Gurman is not here.
Okay,
so you can continue
I'll hand it over to Susan for.
Thank you, Pinder. Thank you for wonderful flow of the presentations. Moving forward, I want to agree, and I appreciate Professor Narendra's presentation, saying how we need to encompass the entire other acts in dealing with this illegal products. And this also came up as a discussion during our 12th series webinar, wherein we were questioned, and if you remember, Dr. Rakesh, it was from the district of Amreli. We were asked that how do we deal with it, because we've confiscated, we seize it, and then over a period of time, one, how to dispose it, what is the procedural thing, and that was the issue. So we were discussing with Dr. Katira sir also, and now I would invite Dr. Jayesh Katira, Deputy Director, Health Department, MACT Gujarat, to share our experiences from Gujarat as to how we've been dealing with this as a state tobacco control cell also, and also by the DRI and SOG otherwise. So over to you, Dr. Katira.
Okay, good afternoon all. It is nice to hear in the webinar. I am sharing my presentation without wasting much of time. Please allow the sharing my presentation so we can conclude and we will discuss in the detail everything. So my presentation is visible?
Yes, sir.
Yeah, you need to be quick with the presentation in the interest of time.
Thank you. I will be very brief.
Thank you.
Okay. So what Gujarat has done, that intervention we have made it in the chronological order. as Avinash has said me, that India has banned this on the 5th December 2019, but Gujarat have introduced this law on the 3rd of July 2019, and before the India has started the taking the action on that. Gujarat has previously taken that action. So in the chronological order, in February 22, Special Operation Group SOG seized the e-cigarettes. We are here in Gujarat joining with the Cybercrime Department, Police Department, and Revenue Intelligence Department work on the e-cigarettes. So the different department, whatever they have done, I have mentioned on the September 14th, the Directorate of Revenue Intelligence on September, in that only month, DRI has also e-cigarette worth of 48 crores in the Gujarat, in Gujarat, that is in the Kutch. So it is in the chronological order. I am not reading out everything. The main importance we have to discuss, that we have already learned that smuggling in the e-cigarette is the main problem. Various act in the e-cigarette is again a various agency who is dealing with the various act. We have to summarize all the acts and we have to join all the acts with the full authority. So I am going the next slide. So we have done the enforcement coordination from state level up to the district level and level also. The state level committee, coordination committee, we have made district and corporation. There is a committee for that, and legal officers and legal action is also for the ensured for that. Next. So due to this some activities, these are the our achievement somewhat. I am not much satisfied with this achievement, but they are there. I am just mentioning it. Next. So various initiatives taken by the state. One is the strategy. That strategy we have to plan and manage and maintain. So first strategy is regular meetings. That meetings we are discussing under the chairman of commissioner here at the state level, and the same is percolated through the downwards via the SETCOM up to the school level for our tobacco cessation center, which is running in our medical college and dental colleges. We have planned tobacco free villages, and with the administration of the district level, as Sushant has said, Amreli district has chosen all their school in the tobacco free toffee, and also ask for the free villages. So that is the plan from the Amreli. We are going one by one step to make tobacco free villages in all the districts. And the IC for that, it is more important, where in IC we are getting the supports, and due to this IC, our as he said that revenue intelligence department and the police department, they have done the e-cigarette cases in 23 and 24 till today. So in 23 there are 236 district wise. We have distribution of these cases that is done for the e-cigarettes, and that is the strength that joining each and every level at the with various department. Next, please. So in the tobacco free youth campaign is also going on. This is 60 days campaign. In that we have done the various activities regarding the PECA. This is the summarization of the various activity. I am not going much into the detail, but which department is involved, that I am rightly to mention that Home Department, Revenue Department, Health Department. So everyone is joined together, and that is the main strength of the Gujarat, and Gujarat has done something down there. Thanks.
Thank you, Dr.
Thank you.
Jayesh.
Thank you, Dr. Katira. Thank you so much for showing us how we are dealing with the issue of illegal cigarettes, and especially e-cigarettes in Gujarat. Now I would like to invite Mr. Shri Satendra Kumarji from DRI Surat, and I would like him to share his experience as a DRI agency to deal with the e-cigarette issue in Gujarat, and when seizures happened in Surat as well as in Kanlapot and Mundra in the past that have been done. Over to you, sir.
Thank you, madam. Respected host and members of this webinar, myself Satyendra Kumar, Senior Intelligence Officer, DRI Surat. DRI Surat is having jurisdiction over the South Gujarat. As you know, DRI is working in line of curbing smuggling of contraband goods under various allied acts under Custom Act. Nicotine product and e-cigarettes are one of the contraband goods on which DRI has trying to detect its smuggling. Recently, in the last 2 years, DRI detected so many cases from at the railway parcel department, transporter premises, shops in Surat, and largest seizure of DRI Surat is e-cigarettes of more than 80,000 pieces in a container imported at the Mundra port. So basically, DRI Surat illegal nicotine products by its 2 ways. First is detection and seizure of illegal contraband goods, and second is awareness campaign. As you are very well aware about the seizure activities of DRI Surat, for the purpose of awareness campaign, I would like to share that DRI Surat is recently last 2 years make a seminar in a nearby school, and so many awareness campaign at Surat railway station for the awareness regarding the illegal consumption and sell purchase of nicotine products, including e-cigarettes. Thank you.
Thank you, sir. Thank you for joining us from DRI Surat office, and special thanks to ma'am for sparing.
Susan, I just want to ask Mr. Satyendra. So you are focusing only on Customs Act?
Yes, sir. We are dealing in Custom Act, read with various allied act, under which any product which are prohibited in any act at the time of import and export.
Okay. Thank you. Thank you.
Thank you, sir.
So, moving ahead, I would now like to invite Mr. Prabhakara for sharing his experiences from Karnataka as to how they have been dealing with illegal products, and especially cigarettes in Karnataka state. Mr. Prabhakara, are you here?
Mr. Prabhakar, are you here? So you may call next. I think Prabhakar has left. Yeah.
Okay, may I call the brain in the head of tobacco control, Mr. Ranjit Singh, and he's going to share with us the history of policy making of ends and also his experience on field. And he was also questioned a lot from our districts regarding implementation of PECA in the states and stuff. So I want to invite.
Ranjit is also not with us.
Okay, so I saw him during the inaugural
so
sessions.
Maybe we were late, so he might have left.
Okay,
Yeah.
I will now hand over to Madam Opinder to invite our other guests as well. OP, over to you, please.
So, I would now
Dr. Shubham Kapoor
from Vital Strategies. So he'll be talking about market analysis of the new generation products and a global overview of the same. So,
Shubham, you need to be brief so, as we are late. Yeah, thank you.
Good evening, one and all. Thank you, respected guest and dear panelist. So thank you, Dr. Rakesh, for this opportunity. I think stage is all set, but I'll just spend 3-4 minutes to understand the global overview and then relate it to the context of India. I think I'll brief it in 3 categories, starting with e-cigarettes, HTPs, and nicotine pouches. Current scenario, what we know is that the global e-cigarette market is estimated for e-cigarette to be around $22 billion US, and these are again underestimated approximates. The market is largely fragmented with smaller tobacco companies. So here's the highlight that e-cigarette that started with a boom, where the trans tobacco companies were majorly selling it. Now the market is taken over globally by smaller non-tobacco makers, whereas the transnational tobacco companies, which are primarily the big four tobacco, their share for e-cigarette is around 1/4. When we talk about the most common brands in e-cigarette, these are Views by British American Tobacco, then Juul by Juul companies, then Relics by New Zealand, one of the top most online shop, and Elf Bar, which is again by a Chinese firm. Whereas on the contrary, when we compare HTP, the global market for HTPs, it is nearly ranging between 10 to 20 billion US dollar. And here we see that the major players are the big fours. And we are not talking about the inclusion or exclusion of the separate part of HTPs that we called as sticks, HTP sticks. This data is primarily on HTP devices as a whole. Here, the popular companies are the big fours, that are the transnational tobacco companies. And the most popular worldwide brands are IQOS, that is by Philip Morris International, then Glow by British American Tobacco, Plume by Japan Tobacco International, and Lil by KT&G. So here we see the reverse, because the major players are these big four. Again, under the market of if we go for HTPs, there are a lot of variations among these products as well. Suppose if we talk about IQOS, IQOS has now come up with a lot of zero tobacco heat stick. So under HTP, which is heated tobacco product, there are variations in which heat sticks are now going even zero tobacco. So this is again a market to look at. A very common example, I'll just name it here, is by PMI's Levia, which is a zero tobacco heat stick. So because these are again not subjected to any flavor regulations in multiple global jurisdictions, and these do not fit in any fiscal categories because they are branded as herbal products. So these are some newer products to look at. Talking about the third category, nicotine pouches. So the global market is currently $2 billion US dollar, but these are again figures which I'm talking about 2 to 3 years back. But this market is again similar to HTP because the major player are the big fours. They dominate the market. The most popular brands, I think Dr. Rakesh mentioned earlier. So Zyn by Philip Morris International, Velo by BAT, British American Tobacco, and then number 3 is On by Altria. We also have a product called Rogue by Swedish International. Now, if we see the presence of nicotine pouches in Southeast Asia, I'll give example of Pakistan, and I'll quote a study by Johns Hopkins, in which I think they analyzed a lot of Velo products. And what they found out is the study was done in 8 cities of Pakistan, and around 22% of vendors had Velo as product display on their retail store. And among these, 13% had advertised it. So, I mean, this is the kind of market we are looking at India's neighbor. So I think this is something which is alarming for India again. And again, for nicotine pouches, I think the market strategy to look at, which is to be taken care of, is that it is again available in multiple flavored products, the same strategy that was used for e-cigarette. So I think that's where again we should come up and align ourselves that is ends also looking at such products which are not electronic but available and marketed in a similar way. And I'll just stop at if all of us can look at the recent third quarterly report that PMI aired in the October. So in Philip Morris, they clearly boast how their newer products are the leading products. So I think there's nothing that they want to hide. And the figures are all there. So yeah, I'll stop there, and I'll be happy to take any.
So thank you, Shivam, for being in time. So thank you.
May I now invite Madam Asta Bagga to take over. Yes.
Thank you so
Please.
much. In the interest of time, I will not
Asta
be
Bagga, Dr. Asta
Yes,
will ask you about the how to deal with nicotine pouches specifically. So just focus on that also in your
Sir,
presentation.
it's like the same things apply to nicotine pouches as are to e-cigarettes. We can go about with them under the Poisons Act because, like Punjab, other states has also come up with rules that declare nicotine as a poison in entry 69. And also in the Drugs and Cosmetics Act, also we can go for the nicotine pouches. Also in the newer Bharatiya Nyaya Samhita that has replaced our Indian Penal Code. It also has sections like section 270 that talks about public nuisance, 271 that deals about negligent act likely to spread infection, and section 280 making atmosphere noxious to health. These sections can be utilized. And also the Juvenile Justice Act can be utilized for nicotine pouches.
Yeah.
And even even if nicotine pouches or e-cigarettes, if they are advertised through Facebook and other social media handles, Facebook has strict policies that prevents listing of nicotine items. And also Google and iOS, they have already acknowledged their responsibility not to promote tobacco products. And they have prohibited any sale of tobacco products through their apps using Google and iOS servers.
So, Dr. Asta, you have been a part of the Punjab team. So, since Gurman is not available, so can you just point out what are the good practices by Punjab government?
In terms of e-cigarette?
In terms of these nicotine products?
Whenever Punjab came up with any regulation, also the courts also said, have you told the people about it? So Punjab was under this good practice that they were giving public notices. So the general people were aware of whatever the law is. Because normally when a law comes, the general masses are not aware. So that I would regard as Punjab's one of the best practices, that they had public notices for it.
और आईपीसी ये जो बीएनएस के बारे में थोड़ा सा बता दो बीएनएस
So pardon?
Regarding BNS, what provisions in the BNS can be used for acting against tobacco products? Bharatiya Nyaya Samhita.
I didn't get you, sir. In
BNS, Bharatiya Nyaya Samhita.
Oh, okay, sir. Yes,
I
sir.
think
There are three sections. Yeah. There are three sections. So there's a section 270 that says public nuisance is not allowed, and there's a section 271 that talks about negligent act likely to spread infection or because of a dangerous disease to life. And then there's a provision in section 280 that talks about making atmosphere noxious to health. So these are the sections that were earlier also in IPC. It is only that the name of the act has been changed.
Yeah, thank you.
Along with provisions of PECA, we can also apply these provisions of Bharatiya Nyaya Samhita.
Right.
Thanks. So can we now invite, have we got any more questions, or we can invite Mr. Binoy Matthew to share his views on how media has been an instrumental, or how media has been one of the very important crimes in illegal cigarettes being available in India and the states as well. Over to you, Binoy.
Good evening, everyone. So, first of all, I'd like to congratulate Ministry of Health and Family Welfare, for taking the leadership in banning the electronic cigarette and also regulating OTT platform. That has been a really remarkable and has been a proud moment for all of us who have been working in the tobacco control. So, coming to my previous speaker, everybody has talked about more about how the things at the ground level, and it's really important to use media. Because media has been a game changer and of course has played a very important role in tobacco control, and especially in combating the illegal availability of nicotine products, including e-cigarettes. So if I talk about the journey, when it was started, how the whole process of banning electronic cigarettes started, along supporting the Ministry of Health, the Indian Council of Medical Research white paper, and then other international studies, that has actually supported for the electronic cigarette. So similarly, what was happening, there was a very good campaign, I would say, that that has been initiated. So it was like, there are a group of doctors, there are a group of other civil society, there are huge number of network people who have been writing about the banning it. And similarly, we've been providing information to the media. So the media have played a very, again, both the earned media and the social media, they have published, the articles on the health harms of electronic cigarettes and other, this bringing critical information to the public, I would say that. And these news outlets have actually published the, studies. There were opened articles by doctors and then real life cases that were demonstrating the harms of these products, especially among the youth. So what was happening that time, if I remember that, even the industry has actually approached some doctors, and there were some op-ed articles were being coming up to on harm reduction, promoting this product as an harm reduction. But yes, of course, we were also been monitoring, tracking it, how to counter this, articles, indicating and coming into the limelight, why there is a need of banning, because we need to protect the young children. That was the whole message, that, protecting the young children from this, from this product. So there were quite a lot of, I would say, public awareness campaign have been gone on television, radio, and social media, basically educating the citizens on the dangers of vaping and how these products are marketed as safer alternatives to traditional cigarette despite their health risks. So when India implemented this ban in 2019, media played an essential role in explaining the rationale behind this decision, covering the Ministry of Health and Family Welfare and the discussion in the Parliament. And these reports have actually helped the, the public understand the perspective, the whole and the motivation behind bringing such policies. So there was, I would say that this was a very important step. Yes, of course, enforcement is an issue, and still now it is coming up. But good thing is that the enforcement drive that has been coming up, like from Maharashtra, Gujarat, Karnataka, UP, Punjab, in fact, UP, Noida also. There's a lot of the news that has been enforced. So that is actually creating a buzz, that we need to engage that. So for journalists, from the journalist point of view, I would say that as a TC advocate, we need to provide them the information because they are not aware about it. So we need to keep we need to monitor that what is happening in the and what industry is planning to do that, and those information we can actually give it to the media to create a buzz. And similarly, how the Ministry of Health and Family Welfare had developed this online portal there that also public notices, important advisories going to the state level. All that has been published and created a momentum in the national as well as the state media. So we need to, going forward, we need to support the government, and we need to try out the enforcement takes place in a best way, and this kind of stories should keep on coming. And also what we are seeing that the industry has not been silent. They are going again, they are meeting important doctors, and they're trying to bring out publicizing articles, as e-cigarette as a harm reduction. So we also have to be very vigilant, and we need to ensure that we should also get some articles. We should, though it's a banned product, but yes, of course, it should be continue. The momentum should be continued, because we don't know what is industry has been planning on. So as a TC advocate, I would say that we should continue with we should use both the earned media as well as at the social media as well. Thank you.
Thank you, Binoy. Thank you so much for pointing out the fact that, it is being promoted as a harm reduction strategy. I was talking to one of the officials who's apparently obviously an IS and IPS, and they're like, isn't it a harm reduction strategy and less harmful than other tobacco products? And we had to actually go through the health effects and all of the sessions with such a high-level official as well. So imagine how it must be impacting and how it impacts the children who have no idea as to what this is. So we want to agree on this fact that all of the, we need an integrated, synchronized approach from all the departments, and media becomes one of the essential component wherein we need to create more and more awareness. So I would now request and ask Dr. Rakesh, and Dr. Rakesh Gupta is also from Rajasthan is also here. I'm seeing Mr. Ramesh Gandhi and several others. So now we would open this platform basically for everyone to give us one-liners as recommendations to specific recommendations to ministry or specific recommendations to specific departments. So one-liners, we can have it in
Susan, we can start with Mr. Ramesh Gandhi and Dr. Rakesh Gupta.
Hanji, sir.
So just a minute each.
Yeah, less than that. One-liners.
We are already quite late. Yeah. Yes,
Yes.
Dr. Rakesh Gupta.
So, okay, my one-liner is the comments that I've given, and don't go for the enforcement. That's a longer strategy.
Yeah.
Period.
And another thing from your side is that endgame tobacco is never a possibility without endgame of nicotine.
Surely.
So just to and yeah, Mr. Ramesh Gandhi, please.
Thank you. My one-liner is that since tobacco industry is playing mischievous tactics using media, we need to have a very strong counter strategy to play even harder communication on media using those film stars who are very popular but do not support e-cigarettes or tobacco.
Yeah.
Media strategy has to be countered by 10x media strategy.
Thank you, Dr. Ramesh. So I request all to just send us the recommendations, just 2 or 3 points in the recommendation to be drafted, which will be sent to all the concerned stakeholders, especially the ministries and the departments in the states. So kindly send those to me or to Susan. So thanks a lot. So Susan, so
Yes.
any more questions or any
I have
recommendation?
one. I have one question to Professor Narendra, Satendra Kumar, and anyone who can guide me. So I had one party coming down from Sweden. They have they came here to check on nicotine pouches that are made in check on the industry that is providing liquid nicotine for nicotine pouches in Sweden. And this company is in Anand. It's called Nisol. Since it's the fraternity here only, I'm naming the brands also, and it was for Velo pouches. And I was completely blank as to how do we deal with it. And I guess Professor Narendra did mention that there are various other acts under which we can deal with this.
Yeah, I'm here to answer your question.
Yes, please, sir.
Please give me the pointed question. You are asking a question about the nicotine pouches or patches. Nicotine pouches or patches is not an approved dosage form of any nicotine drug. They are making this product, either they have obtained the permission wrongly, or if some new drug permission has been granted, that required to be checked. But nicotine pouches or patches, these are still covered under Poison Act 1919 because nicotine is a poison. And number two, if they are claiming that these are to be used for the cessation of cigarette smoking, that then this claim is absolutely wrong. Second and thirdly, action against such can be taken if these are not approved by the DCGI, then as an unapproved dosage form of a drug under Drugs and Cosmetics Act. If the particular firm has got the approval from the DCGI, then under the Poison Act. That is my input.
Susan, I think if Mr. Ahooja agrees that the Drug and Cosmetic Act can be very easily used against nicotine pouches because these are not approved products.
Yes.
Yeah.
Yes.
So the issue here is that Satendra sir, is that this is a company producing liquid nicotine, providing it to this company, obviously to Sweden. This thing, and Velo is BAT product, right? So they are exporting it. So I was like, liquid nicotine production.
Ma'am, I request you to share the detail of the company who is exporting that product to purchaser, so that
I
we
can do
analyze the data and take necessary action as deemed fit.
Great.
share the
I'll do
the
that.
company
I'll
details.
do the I'll do the
Just a minute, before making any letter, before issuing any letter or representation to the government or the ministry or the DCGI, we need to check whether that company has got the permission or taken the approval from DCGI. If they have taken the approval from DCGI, then our representation will go to the Joint Secretary Health. Or if he has not taken any permission, he is doing it illegally or under the carpet, then our representation will go directly to the DCGI for taking a necessary action under Drugs and Cosmetics Act.
Great. Thank you so much, sir, for clarifying this for me.
Thank you.
Over to you, sir. Dr. Rakesh, over to you, sir.
So thanks all. I think all the experts, they did a very good job and enlightened us in drafting the recommendations. So all experts, all participants who are with us, I think we were more than half an hour late. Still you are with us. So thanks a lot. Thank you.
Dr. Gupta, still everybody is interested that this consultation should have gone much beyond the time, because this is very important meeting which has been held. Thank you very much to all the organizers.
And Professor Ahooja, you can send us the recommendations.
Yes, definitely.
Sir, I'd
different
also like
ministries
to
and
thank officials who have joined us from the district also. From Bharuch, we have
Yeah.
Dr. Nilesh Patel.
So they are all experts.
Yes,
Susan, they are all experts.
Yes, so they have joined us also. Thank you so much. Yes.
Thank you.
So thank you.
Thank you, one and all.
Thank you all.
Any question, please?
Yeah,
Any
I have a
questions?
quick question.
Please.
Yes.
Now we have nicotine sprays that are used for.
Please introduce yourself from where you are.
I'm Dr. Rizwana from Karnataka. And the question is, now we have nicotine sprays that are used for smoking cessation. Are they legal? Are they allowed?
These are illegal. These are illegal because these are not covered under COTPA. COTPA says only about tobacco, not about nicotine. For nicotine, it is applicable. Act is Drugs and Cosmetics Act, Poison Act, and both are not yes to the nicotine cigarette. This is harmful. One tobacco cigarette and one nicotine cigarette is equivalent to 40 tobacco cigarettes.
Okay.
As far as
because they're selling the spray here and they have the dosage like the nicotine gums and patches. They have the dosage and everything. So should I ask them for?
Yes, you can take action. You can take action and you can ask the concerned drug inspectors also to take action under the Drugs and Cosmetics Act to stop these type of things, activities.
Okay, sir.
Rizwana, we have Dr. Shivam answering it. Check for the registration and license.
To check this.
Oh,
yeah. Registration and the license can be checked, ma'am.
Okay, because this is from a pharmaceutical company, so I was just wondering.
Right.
Thank you so much.
Fine.
Later on also, if you have any questions, I'll just put my email ID in the chat
yes,
box.
Sir, that would be great.
So that you, I'll just put down my email ID so you can send your questions. Please.
Okay, thank you.
Susan, you can also put down your.
Yes, sir, I'll do that. Yeah.
So this discussion was really nice and very thought-provoking also, and I think it will be useful webinar since MHFW officials were with us. So I think this should go to the right place. So thanks all. So thank you all.